Examination of the hip. The aim of this video is to introduce students to the examination of the hips. The objectives are: be able to demonstrate examination of the normal hip, to describe the surface anatomy of the hip, and to be able to demonstrate assessment and measurement of limb length. The whole length of the limb must be uncovered in examination of the hip. Inspecting from behind, you should look at the height of the shoulders to ensure that they are equal. Look at the alignment of the spine to determine that there is no scoliosis present, and look for any wasting of the gluteus maximus muscles. From the sides, look for any wasting of the muscles around the hips. Your inspection should include looking for any deformity, skin changes, scars or sinuses, and if there is any flexion deformity of the symptomatic hip. Inspect the patient as they walk across the room, turn, and walk back. Before you ask the patient to lie on the examination couch, take this opportunity to perform the Trendelenburg test. A positive Trendelenburg sign is found in patients with weak or paralyzed abductor muscles of the hip, namely the gluteus medius and gluteus minimus. There are many variations to performing the Trendelenburg test. One variation requires you to place your hands on the iliac crests to determine the level of the pelvis. Ask the patient to stand on one leg and observe from behind whether the opposite buttock sags or whether the pelvis drops to the opposite side. This could indicate weakness of the hip abductors of the standing leg, pain, shortening of the femoral neck or subluxation of the hip, and constitutes a positive Trendelenburg sign for that hip side. In the normal hip, the opposite buttock should elevate. Another variation to the Trendelenburg test is to ask the patient to perform the test without any assistance and without the examiner holding the pelvis or patient. A positive finding is indicated as before when the opposite buttock sags. The hip joint is deep to the hip muscles and cannot be palpated directly. Palpate the symphysis pubis, inguinal ligament, anterior superior iliac spine, iliac crest, and greater trochanter to elicit any tenderness and determine if any swellings are present. Before you examine the range of motion of the hip, it is important to determine if there is any fixed flexion deformity of the joint. This can be done by performing Thomas's test. With the patient lying supine, place your hand under the lumbar spine to check for normal lumbar lordosis. With your hand still under the lumbar spine, flex one hip, bringing the knee to the chest to flatten out the lumbar region. Observe the opposite leg to see if it remains on the table, indicating that there is no flexion contracture. If a flexion contracture is present, the leg will raise off the table. To assess the range of flexion of the hip, place your hand under the patient's back and bring his knee to the chest until you feel the lumbar spine flatten out. To assess rotation, flex the knee and hip to 90 degrees. Keeping the femur upright and steady, rotate the femur and move the foot to the side to assess internal rotation and inward to assess external rotation. Before you assess for abduction and adduction of the hip, you will need to square the patient's pelvis first. Squaring the pelvis is to ensure the hips are exactly 90 degrees to the line between the two anterior superior iliac spines. Squaring the pelvis before you assess movement will ensure that the hips start in the same neutral position or starting point. Place one hand on the opposite side of the pelvis to steady it, then abduct and adduct the hip to assess its movement. Complete your examination by measuring the limb lengths. Limb shortening can be detected during the inspection phase and assessment of gait. The Galeazzi test can also be used to detect limb shortening. Flex the knees to 90 degrees and place both feet at the same level. Looking from the patient's feet upwards, determine that the height of the knees are symmetrical. Unequal knee height from this view indicates a shortening of the tibia. Looking from the patient's head downwards, look at the height of the knees again. Unequal knee height from this view indicates a shortening of the femur. Next, measure for apparent limb length. Apparent limb length shortening is due to orientation or position and means that the limb may not be actually short because of the position of the patient. Start by identifying the xiphisternum and tip of the medial malleolus. Measure the distance between these 2 points for both limbs. Measuring true limb length is to determine the actual length of the limb. A true limb length shortening means that the limb is short because of structural defects, such as in the cases of fractures, dislocation, or growth deformities. Firstly, square the pelvis to ensure that both the limbs are in the same position in relation to the pelvis. Then, identify the ASIS and the medial malleolus and measure the distance between these 2 points for both limbs to obtain the true limb length for each limb. To measure the true limb length for the femur, measure from ASIS to the medial joint line of the knee. To measure the true limb length for the tibia, measure from the medial joint line of the knee to the medial malleolus. In the event that a shortening is found in the femur based on the measurements, the next step is to identify where exactly is the shortening along the femur, whether it is along the shaft of the femur, which is below the trochanteric line, or if it is above the trochanteric line where the femoral neck and head and acetabulum are. To do this, you should then proceed to perform measurement of Bryan's triangle. Firstly, square the pelvis. Identify the ASIS and draw a vertical line downwards towards the bed. Next, identify the tip of the greater trochanter of the femur and draw a line from the tip to the vertical line from the ASIS. The line between the GT to the vertical line is the base of Bryan's triangle and should be measured and compared between both sides. Equal measurements on both sides is normal. A difference between the two sides would suggest that the femoral shortening is above the trochanteric line. To summarize, identify if shortening is present by inspection, performing Galeazzi test, and measuring the apparent limb length. If a shortening is found, to determine if it's real or apparent, you should measure the true limb length. If it is truly short, then you need to find out if the shortening is above or below the knee. That is to say, if the shortening is in the femur or tibia. To answer this question, you should measure the true length of the femur and the true length of the tibia of both legs and compare. If a shortening of the femur is found, you need to measure Bryan's triangle to determine if the shortening is below or above the trochanteric line.